Dry skin treatment ointment is used as a moisturizer to treat or prevent dry, rough, scaly, itchy skin and minor skin irritations such as diaper rash and skin burns from radiation therapy. Emollients are substances that soften and moisturize the skin, decrease itching and flaking, and some products are used to protect the skin against irritation from wetness. Dry skin is caused by a loss of water in the upper layer of the skin, and emollients/moisturizers work by forming an oily layer on the top of the skin that traps water in the skin. Common emollients include petrolatum, lanolin, mineral oil, and dimethicone, while humectants such as glycerin, lecithin, and propylene glycol draw water into the outer layer of the skin. Many products also have ingredients that soften the top layer of skin cells and help the dead skin cells fall off, allowing the skin to keep in more water and leaving it feeling smoother and softer. Make sure to use this dry skin treatment ointment as directed. Some products may need to be shaken before use, so be sure to check the label. Apply the ointment to the affected areas of the skin as needed or as directed by your doctor. The frequency of application will depend on the product and your skin condition. If you're using it for dry hands, you may need to apply it every time you wash your hands throughout the day. For diaper rash, make sure to clean the diaper area well before applying the ointment. And if you're using it for radiation skin burns, check with radiation personnel before applying it. Be sure to only apply the ointment to the skin, and avoid sensitive areas such as your eyes, mouth, nose, and vaginal/groin area, unless directed otherwise. Also, make sure to follow the label for any specific directions on where not to apply the product. For best results, use the ointment regularly and apply it to damp skin, such as after bathing or showering. If your skin is very dry, your doctor may recommend soaking the area before applying the ointment. And remember, long or frequent bathing can make dry skin worse. If your condition doesn't improve or gets worse, be sure to seek medical help right away. When using dry skin treatment ointment, it is important to be aware of potential side effects. While most emollients are safe and effective, some people may experience burning, stinging, redness, or irritation. If any of these effects persist or worsen, it is important to contact your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. However, it is important to notify your doctor immediately if you notice any unusual changes in the skin, signs of skin infection, or symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. It is also important to note that this is not a complete list of potential side effects. If you notice any other effects not listed, it is important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA. If you are in Canada, you can report side effects to Health Canada. Before using this dry skin treatment ointment, make sure to let your doctor or pharmacist know if you are allergic to any of the ingredients, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems. If you have skin cuts, infections, or sores, it's important to consult your doctor or pharmacist before using this product. Some of the ingredients in this ointment, such as preservatives and fragrance, may make you more sensitive to the sun. Be sure to check the label for any warnings, and ask your doctor or pharmacist if you need to take any special precautions when in the sun. Your doctor may recommend limiting your time in the sun, avoiding tanning booths and sun lamps, and using sunscreen and protective clothing when outdoors. If you experience sunburn or skin blisters/redness, let your doctor know right away. If you are prone to acne breakouts, some products may worsen acne. Look for the word non-comedogenic on the label, which means it will not clog pores. Additionally, some products may stain or discolor clothing, so it's best to ask your doctor or pharmacist for more details. Before undergoing any surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, be sure to inform your doctor before using this product. It is also advisable to consult your doctor before breastfeeding, especially if you are applying this product to the breast area. It's important to be aware that dry skin treatment ointment may interact with other medications you are taking, potentially affecting how well they work or increasing your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this information with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medications without first obtaining approval from your doctor. If this ointment is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms like fainting or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222, and Canada residents can call a provincial poison control center. When it comes to preventing dry skin, there are a few simple steps you can take. First, try using lukewarm water instead of hot water when bathing. You can also try to take baths or showers less often, like every 1 to 2 days, and keep them short. Another helpful tip is to use a humidifier when the air is very dry. There are different types of emollient products available for dry skin treatment, such as oils, creams, lotions, or sprays. Some of these products may contain fragrance or other ingredients that could cause sensitivity for some people. It's best to consult with your doctor or pharmacist to find the right product for you. If you forget to use this ointment on your regular schedule, just use it as soon as you remember. But don't use extra ointment or use it more frequently than directed to make up for the missed dose. Make sure to check the storage instructions on the package and ask your pharmacist if you have any questions. Keep the ointment away from children and pets. Avoid storing the ointment near high heat or open flames, as it is under pressure. Do not puncture or burn the container. Do not flush the ointment down the toilet or pour it into a drain unless instructed. Properly discard the product and it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.